Hi, my name is Patrick Lynn. I was a fellow who trained at UC Davis Hematology Oncology Fellowship. I graduated in June of 2018 and have been practicing at Kaiser Permanente in Roseville. I chose UC Davis for many reasons, especially for the quality and rigor of the training program, the collegial culture and environment, and most importantly, the faculty and staff who over the course of 3 years permanently became a fixture in my life and my family forever. What makes training at UC Davis unique is the fact that it is one of the rare programs in the country that has a designated fellows clinic, where a fellow in training takes complete responsibility over the care of hundreds of patients from the point of cancer diagnosis, treatment, management of side effects, surveillance and disease remission to progression, all the way to survivorship or palliative care in hospice. It truly takes a village to raise a doctor, and in my 3 years at UC Davis, I had the privilege to learn from some of the best and most caring faculty members, physicians, nurses, and ambulatory staff who mentored, challenged, and pushed me to be the very best that I possibly could be. They have prepared me well in knowledge, skill sets, and most importantly, compassion to deliver good cancer care in the modern world. I encourage you to seriously consider UC Davis as one of the training programs that you can call home. It was my home for 3 years, and it was a place that forever shaped my life and journey as a doctor and my growth as a person. And I believe it can be yours too.
Hello, future oncologist. My name is Barbara Galligan, UC Davis School of Medicine, class of 2008, and UC Davis Hematology and Oncology Fellowship, class of 2016. I am currently a partner in a private practice in Northern California, where I see a wide range of hematology and oncology patients. Fortunately, my fellowship at UC Davis prepared me well for this challenge, because it is a rigorous program with many well-supervised clinical hours. In addition, the faculty will teach you how to teach yourself to stay current in this rapidly changing, ever-developing field. I think what I most appreciated about the fellowship was that it allows you to be the master of your own destiny. While the clinical experience will expose you to a diverse patient population across the entire breadth of hematology and oncology practice, the program is small enough that you have direct contact with faculty. That means that you get to pursue your own choice of research. And while I chose clinical practice, I watched as some of my co-fellows worked with faculty to launch themselves into exciting research and academic careers, both in California and across the country. The faculty and the size of the program create a very supportive culture. I never felt any discrimination or bias against me for having family commitments to my husband and 3 children. And once I finished fellowship, I became part of a dynamic alumni network that helped me land my current job. In today's difficult times, I think that working at a place that has a supportive culture is just invaluable. So I hope that you choose UC Davis for your hematology and oncology fellowship. Congratulations on finishing residency, and good luck.
Hi everyone, my name is Raj Krishnan, and I graduated from the UC Davis Hematology Oncology Fellowship in June 2018. I currently work for Kaiser Permanente here in Portland, Oregon, with a focus in malignant hematology. Why I chose UC Davis for fellowship, there were 2 big reasons. The first was that I knew it was a program that provided strong clinical training and excellent research opportunities, and I most enjoyed having my own clinic with a panel that I was a lead in regards to treating. The second and more important reason was that even from the interview day, I felt like I was home. Immediately, the program and department felt like family, and everyone was very supportive, which was important to me for fellowship. As to a memory or special moment from fellowship, there are definitely way too many to decide from, both clinical and non-clinical, but if I were to try to pick one of each, a clinical one would be that after an extremely long night and rough call, The attending I was on with called me early in the morning to make sure I was doing okay, brought me coffee and breakfast, and my co-fellows covered my pager to get me home a little earlier that day. This was a simple but important expression of a camaraderie and support at all levels at UC Davis. The support and respect extends to a deeper level as well. If the fellows brought an issue to the program, I felt the program directors listened to the feedback and worked hard to make appropriate changes. On the non-clinical side, just from the interview, again, I could tell that the fellows and faculty spent time together outside of work, which is important to me. From biking, happy hour, river rafting, dinner at attendings' houses, trips to Tahoe, we did it all. Sacramento is a vibrant, fast-developing city with lots of great food and drink, and definitely a lot of outdoor experiences close by to take in on your days off. On my interview trail, I felt that a lot of programs had fellows and mentors who hang out together outside of work. And then the event we all look forward to each year was the retreat. This experience allowed us to talk about the non-medical side of work and process dealing with such an emotionally involved field. There's also a focus on team building and career development, and then it culminated with an amazing dinner and drinks. Families are invited, and it's amazing to get to know more about your coworkers' families and spend time with them. I believe it's one of the few or only fellowship to do such a retreat that's off campus and in Sonoma. And then overall, UC Davis prepared me very well for practice, I feel without a doubt, as my focus is malignant hematology, the inpatient service, and consult service taught me to manage acutely ill patients confidently. Having my own fellows clinic prepared me for, to be efficient in the outpatient world, which is priceless, definitely starting here at Kaiser. And in looking for jobs, UC Davis has connections throughout the country to help you find the right opportunity for you. I was able to network with alumni and found out about my current job, as there's a former fellow from Davis here who's part of my group, and she was instrumental in bringing me up here as well. So hopefully this helps. I wish you all the best, and have a good one.
Hi applicants, I'm Julian Davis. I'm a hematologist-oncologist currently practicing in Santa Barbara, California. I'm a graduate of the UC Davis Hem-Onc Fellowship Program in 2018, and prior to that did medical school at the Royal College of Surgeons in Dublin, Ireland, and then medicine residency in Philadelphia. So I really like the UC Davis Fellowship Program because it was close-knit. The faculty were like our family. We were able to ask any of them anything regarding any teaching topics, or particularly our own patients in continuity clinic. And it really prepared me with a very strong foundation for my current practice at a larger community cancer center, which does significant amount of clinical research. So both the depth and breadth of exposure to Hem-Onc cases for consultation and for primary outpatient treatment, and also running clinical trials and opening them at our site, which I currently do. In addition, out of my colleagues, I think I got a even stronger heme and leukemia inpatient experience, which I've now translated to my current practice, where we do leukemia inductions and basically everything except transplant. Faculty I still connect with very often, both for ongoing clinical questions day to day, see them at the meetings, ASCO and ASH, and it's a good community and a good background to have regardless of where you end up after training. Thanks.
Hello, my name is Rahel Demissi. I'm one of the recent graduates from UC Davis Medical Center Hematology Oncology Fellowship. I graduated in the summer of 2019, and I currently work for Loma Linda University Health as one of the medical oncologists. I hope with this short video that I will be able to answer some of the questions that you may have about UC Davis Medical Center Hematology Oncology Fellowship. The first question is, why did I choose UC Davis? There were so many reasons why I ended up choosing UC Davis for my training, but to name some of them, patients in this facility, they have ample opportunity to receive cutting-edge and personalized treatment, and they have access to a variety of clinical trials, which was an attraction for me. In addition, I like the multidisciplinary nature of patient care. Patients have access to social work, case management, pharmacy consults who calls them to follow up to see whether they're taking the oral medication or not, and nursing navigators who calls and check up on them. Also, I like the fact that I would have the opportunity to work with the experts in the field. These are, the experts that publish so many papers, great mentors with open door policy, whether you are trying to run a case by them or, you're just going to their office to ask for a new project that you can be involved in. This was a very attractive training environment for me. Above all, on my interview date, I had a great experience. So some of my special moments during my training at UCD is actually when we went to retreat. This is the moment where everyone's hidden talent actually comes out. Some of our seniors playing guitar, Julian playing guitar and singing, Leslie singing opera, also Dr. Christensen singing a duet with Leslie and playing game with the attending. It's one of the special memories that I have about UC Davis when we went to retreat, and we had it every year, and this was a great bonding experience, that I must say. So how did my training at UC Davis prepare me for the real world experience? I must say very well. I'm actually very confident in managing patients with a variety of cancers now. As a fellow at UC Davis, you will have immense experience in managing patients in inpatient setting, bone marrow transplant, and in a clinic setting with the experts in the field. In addition, you will be rotating at the VA system, where you'll be seeing the bread and butter cases, the typical bread and butter cases. When the combination of the two practices actually a very good learning environment. In addition, actually during my research block, I used to go to additional clinics so I can have exposure to the experts, more exposure to the experts in the field, which was a really good learning experience for me. Another thing that UC Davis prepared me was the fact that I had ample opportunities to be involved in research. If you're willing to work hard, you can potentially be involved in multiple research. I was involved in 7 projects that I started, and some of which led to publication posters and peer review publications, and this is as first or second author. So this is a very good opportunity, and it has prepared me for a career in academia. Another thing that I would like to mention is that working with the experts in the field here at UC Davis who are well connected in the research community will open up lots of doors for you. By working with one of the GI experts, Dr. Cho, I was able to make lots of connections with other institutions, including City of Hope, UCI, UCSD, Cedars-Sinai, and other institutions. The good thing is that I'm still networking with these institutions for continued research opportunities, which is, very important thing for me. And one more thing that I would like to mention before I conclude is that the decision that you make, the choice that you make today actually does matter for the rest of your career. I still email my attendings with cases and questions, and I get my answer with evidence-based recommendation and suggestion the same day, which is very important. These are the people that you will be proud to call mentors. I am very fortunate to be part of UC Davis family. I hope you found this information helpful. Good luck with the rest of the interview.